Hi friends, welcome back to No Squares. Today let's discuss DHA, PSC, Jipmer, Aims, Staff Nurse, exam-based questions and answers, section 9, and these questions are from cardiology. First one, heart failure is also known as option A, congestive heart failure, option B, decompensative PODIS, option C, congestive cardiac failure, option D, all the above. Answer, option D, all the above. Heart failure is also known as congestive heart failure, decompensation PODIS, and also congestive cardiac failure. Second one, which one is not the sign of heart failure? Option A, shortness of breath. Option B, excessive tiredness. Option C, leg swelling. Option D, chest pain and myocardial infarction. Answer, option D, chest pain and myocardial infarction. The signs and symptoms of heart failure commonly includes shortness of breath, excessive tiredness and leg swelling. And the shortness of breath is usually worsened with exercise or while lying down. Third one, what are the risk factors for heart failure? Option A, coronary artery disease. Option B, smoking. Option C, high blood pressure. Option D, all the above. Answer, option D, all the above. The risk factors for heart failure are coronary artery disease, smoking, high blood pressure, sedentary lifestyle. Fourth one, a condition in which the heart cannot pump enough blood to meet the body's need is known as option A, heart attack, option B, heart failure, option C, angina, option D, none of the above. Answer, option B, heart failure. Heart failure is a condition in which the heart cannot pump enough blood to meet the body's need. Fifth one, according to the Frank-Starling law of heart, in a normal heart, increased filling of ventricle result in increased dash force and thus a rise in cardiac output occurs. Option A, contraction. Option B, relaxation. Option C, both contraction and relaxation. Answer, option A, contraction. According to Frank-Starling law of heart, in a normal heart, increased filling of ventricle result in increased contraction force and thus a rise in cardiac output occurs. Sixth one, what do you mean by high output heart failure? Option A, the condition in which the amount of blood pumped is more than typical and heart is unable to keep up. Option B, the condition in which infiltrative disorders occur such as amyloidosis and connective tissue disease occurs. Option C, none of the above. Answer, option A, the condition in which the amount of blood pumped is more than typical and heart is unable to keep up. Seventh one, whether viral infection of heart can lead to heart failure. Option A, yes. Option B, no. Answer, option A, yes. Yes, viral infection can lead to heart failure. Viral infection of the heart can lead to inflammation of muscular layer of the heart and subsequently contribute to the development of heart failure. Eighth one, expand CRT. Option A, cardiac resynchronization therapy. Option B, C-reactive protein total. Option C, contraction relaxation technique. Option D, none of the above. Answer, option A, cardiac resynchronization therapy. CRT means cardiac resynchronization therapy. Ninth one, left side heart failure cause blood to back up into the dash. Option A, lungs. Option B, right ventricle. Option C, systemic circulation. Option D, all the above. Answer, option A, lungs. Left side heart failure cause blood to back up into the lungs. 10th one, what are the two types of left ventricular heart failure? Option A, heart failure with reduced ejection fraction. Option B, heart failure with preserved ejection fraction. Option C, biventricular and right side heart failure. Option B, both A and B. Option E, both B and C. Answer, option D, both A and B. The two types of left ventricular heart failure are heart failure with reduced ejection fraction and heart failure with preserved ejection fraction. Third one, how many stages are there for heart failure? Option A, 4 stages. Option B, 3 stages. Option C, 5 stages. Option D, 2 stages. Answer, option A, 4 stages. There are 4 stages for the heart failure. They are stage A, B, C and D. Stage A and B is considered as pre-heart failure, and during the stage, people are advised to do regular exercise and to quit smoking, and also will start treatment for high blood pressure and high cholesterol level, and also will advise to stop drinking. Stage C, patients are diagnosed with heart failure, and during this period, the person may experience shortness of breath, feeling of tired or fatigue, and weak legs, less able to do exercise. The usual treatment plan for the patient with stage C heart failures are beta blockers, aldosterone antagonist, hydralazine or nitrate combination, medications that slow the heart rate if the heart rate is faster than 70 beats per minute, and also will add diuretics. And the stage D heart failure means this is the final stage of heart failure. The usual treatment plan for the patient with stage D heart failures include heart transplant, ventricular assisted device, heart surgery, continuous infusion for the intravenous inotropic drugs, and also will provide palliative care. These are the stages of heart failure. There are 4 stages of heart failure, that is stage A, B, C and D. 12th one, what does the S4 heart sound most commonly indicate? Option A, myocardial ischemia and diastolic congestive heart failure. Option B, diastolic congestive heart failure and cardiac tamponade. Option C, cardiac tamponade and systolic congestive heart failure. Answer, option A, myocardial ischemia and diastolic congestive heart failure. Heart sound most commonly indicate the myocardial ischemia and diastolic congestive heart failure. 13th one, expand HOCM. Option A, hypertrophic obstructive cardiomyopathy. Option B, hypertrophic occipital clavicle muscle. Option C, hypertension induced obstructive cardiac rupture. Answer, option A, hypertrophic obstructive cardiomyopathy. HOCM means hypertrophic obstructive cardiomyopathy. 14th one, expand ATP. Option A, adequate adenosine triphosphate. Option B, adequate transport protein. Option C, active adenosine triphosphate. Answer, option A, adequate adenosine triphosphate. ATP means adequate adenosine triphosphate. 15th one, the condition in which the force of blood against the artery walls is too high is known as option A, hypertension. Option B, hypertension induced hemorrhage. Option C, cardiac tamponade. Answer, option A, hypertension. Hypertension is the condition in which the force of blood against the arterial wall is too high. 16th one, high blood pressure is termed as option A, primary and secondary hypertension. Option B, diastolic and systolic hypertension. Option C, primary diastolic and primary systolic hypertension. Answer, option A, primary and secondary hypertension. High blood pressure is termed as primary and secondary hypertension. 17th one, blood pressure is expressed by dash measures. Option A, 2, option B, 3, option C, 6. Answer, option A, 2. Blood pressure is expressed by two measures, that is diastolic and systolic. 18th one, express RAS or RAS. Option A, renal artery stenosis. Option B, rapid assessment scheme. Option C, radial artery swelling. Answer, option A, renal artery stenosis. 19th one, the term used to refer severely elevated blood pressure is option A, hypertensive crisis. Option B, hypertensive urgency. Option C, hypertensive emergency. Option D, all the above. Option E, none of the above. Answer, option D, all the above. In hypertensive emergency, there is an evidence of direct damage to one or more organ. The most affected organs include brain, kidney, heart and lungs. And during this period, the person may experience confusion, drowsiness, chest pain and also breathlessness. 20th one, the difference between systolic and diastolic blood pressure is known as option A, arterial stiffness. Option B, isolated systolic hypertension. Option C, pulse pressure. Option D, none of the above. Answer, option C, pulse pressure. The difference between systolic and diastolic blood pressure is known as pulse pressure. Thank you.